Hi, I'm Mina Malik Hussain and you're watching The Coffee Table, and I'm very excited for several reasons. And one of them is this pink shirt I'm wearing. And the other reason is that this is such a wonderful show and it's about a topic that's very close to my heart, considering that I have like 1,000 children. And today on the show, we're going to be talking about the challenges that new moms or just moms face while feeding their kiddos. It's strange because parenthood is a very fraught time in a woman and a man's life, but we're going to talk about women mostly here, so sorry dads. People seem to think that everything should come naturally to a mom, new or not, and some things really don't, and it's really important to keep having these conversations and talk about the challenges that women face whilst having kids and raising those children and what we can do to support them. So today on set, we are joined by Tanya, Dr. Tanya Soomro, not just any Tanya, Dr. Tanya Soomro, who's a consultant pediatrician at the Lahore Children's Center, and Hareem Sumbul, who is a breastfeeding counsellor and a member of the Lactation Consultants of Great Britain. Hi, welcome to the show, both of you.
Hi, thank you.
And this
Thanks
was
for
a
having
very
us.
long and very dramatical kind of introduction. You know, Tanya's old hat now. She's just like, this is how we roll. But hi, new person. So today we're talking about breastfeeding and sort of the challenges that women face, you know, the work that you guys are doing to support that. And I think let's sort of begin at the beginning as, you know, one does. And so, Tanya, Dr. Soomro, so a woman's breastfeeding journey begins once she has a baby, of course.
You know, I feel like it begins a little bit before that.
Oh.
Yes, because I think that before that, you have to get in that mindset that I'm going to feed my baby myself.
Oh, okay.
You know, I think even with the bras that you choose, for example, with the equipment that you buy. So you'll see that if moms are planning to bottle feed, they'll buy all the sterilizers, they'll buy the bottles, often they'll buy the formula in advance, right? So if you're planning to breastfeed, then you think about different supplies. So you might want to get a breast pump, you might want to get, you know, storage bottles, storage bags, things like that, and a sterilizer. You probably would need that too.
That's interesting. I don't think I really considered it that way, although I have done all of these things. I'm like, well, obviously. But it's interesting, and I'm bringing it up because for a lot of, and I can't speak globally, but at least in our culture, the expectation is always very much that you're having a baby and you're going to feed your baby. And of course, it's the sort of natural way of doing things.
I think it's not as simple to define the entire culture that we live in on one strata, because there are multiple minuscule and different layers of society where we're surviving right now.
Yeah.
So there's a layer of society that still expects that the mother will feed the baby herself, and then there's a ton of people out there who are of the mindset that, you know, it's very rare that we can possibly feed our child, so let's just go with formula. You know, or go with that mindset. So we can't say that today's Pakistan or today's this part of the world even, we can't say that we are of a mindset that, oh, we thrust breastfeeding upon women, or we have that expectation that they will do that, or they will do another way. It really is much more complicated than that. You know, because the anthropology that goes into that is far more complicated now. You know, I mean, probably 25 years, 30 years ago, it could have been more homogeneous, but now it's not.
And probably because there wasn't that much formula, at least available in this part of the world. So
yeah, it wasn't available. It was much more expensive. But with times, a lot of multinationals and other products as well. A lot of other stuff has started coming to Pakistan, and we have a lot more access to a lot of other products, not just baby products, other products as well. So along with all of those things, we now have multinationals who are present in Pakistan and are producing and, you know, manufacturing and supplying baby formula as well. So there's that too. So obviously all of those things have an impact on the culture of any society or whatever is expected of mums and what's not.
So I'm going to I want to talk about expectations in further detail, because so much to say, so many things. But as a doctor, Tanya, could you sort of walk us through the process, if assuming, you know, but at this juncture, I would also like to say that fed is best, because the main thing is to make sure that your baby is healthy and that your baby is fed. And the way you do it is something that it's
I
up
think
to
it's your
you.
own choice, actually,
it
isn't
is
it?
your
That you
own
have
choice.
to. I feel that the main thing is that, like as a medical professional, I would want to know that I had educated a mom, that I had taught her how to feed, because I think that's where we're really lacking, right? That often, doctors also don't provide that support, that if you have antenatal classes, you know what to expect. If when your baby is born, if your obstetrician has told you that, yes, look, that you'll be breastfeeding, we'll support you in it if that's what you'd like to do. If the midwife can help you with latching on, with positioning, with attachment, can troubleshoot for you in the postnatal ward. And if your pediatrician is also supportive, that's what you need, And I think that too often a lot of doctors also want that control. So they want to know, okay, how much is the baby drinking? I don't want the baby's blood sugar to drop.
Yeah.
And so they will, a lot of babies I feel who are born here, particularly who are born privately, will immediately be whisked away to the nursery, will be given a bottle of formula,
Yes.
and then will be sent back. And that way you've kind of already made that choice for the mom, So I feel that, yes, that the choice is up to the mom, but that you should train her and prepare her fully so that she feels confident in making her decision.
And I think it's really strange that a lot of setups don't have that kind of conversation when you go in. And even with, like you said, it's between your obstetrician and your pediatrician, and also some kind of nursing support, where it seems like a lot of pieces have to sort of fall into place to talk about it.
And and I feel even, for example, breastfeeding rooms, So when you have a baby who's admitted, like it's hard enough if your baby is born and is well and is with you in the room, But if your baby is actually unwell or is premature, is admitted to the baby unit, then it's far more challenging, right? Because actually for the hospital, they need to have a screen, they need to have maybe a separate room where you can go feed the baby or where you can go and express and the expressed milk can be given. So there needs to be a lot of support, from the medical profession towards that.
Quite right. So in the beginning days, in this sort of, once a baby is born and then the first sort of few weeks, a mom is producing colostrum. Right. So what is that?
So colostrum is basically the initial milk. It's not really for the first few weeks. It's basically until the milk comes through,
All right.
So it's the first few days.
Okay, days. All right.
And it's basically almost like a honeyish kind of substance, and it's full of antibodies, protective substances. And actually, I feel like here, there are so many myths about breastfeeding. And one of the myths is that colostrum is unclean.
Really?
And that needs to be discarded.
Yes.
Yeah, there's that
Unclean?
belief as well.
Yeah.
Wow, I'm glad I never heard of that. It's not unclean, it's great.
It's probably the best thing you can give to your child. Yeah.
So, the thing is that I feel in a lot of, let's say, particularly if a mom has had a C-section, people will immediately say, well, she can't, breastfeed, so let's put the baby on formula.
Yeah.
And then in 3 days' time, we'll start breastfeeding. And that's wrong too, because if you support a mom, she can breastfeed, right? From the start, she can breastfeed.
Okay, so in spite of a C-section, there is no bearing on your ability to nurse your baby.
No, it doesn't at all.
I'm here. Right here.
Yes, we've got an example.
Living example
here.
Yes.
But why would people think that?
Because see, and I don't really blame people for thinking that, because until a lot recently, there were general anesthesia C-sections happening as well. It's only more recently in the past decade or a little more than that, maybe 20 years or so, that we've actually started using spinal tap and other ways that the mother is sane and lucid and around conscious enough to actually, be able to feed a child. And then, general anesthesia, the anesthesia is in your blood, so also that has to leave your body before you.
And obviously, it takes a while for you to regain consciousness. You might be in an HDU setting initially.
So you usually would miss the first, what we call the golden hour, the first hour after birth, in which it is essential for a child to be united with the mom, basically.
Really?
Yeah.
Latching on.
That's
and
the
like
best thing for early initiation. Yeah. So and that's the time when, if you even place the baby on top of the mother, the baby will naturally root and reach out for the breast. And that's a natural, because it's a natural instinct.
Yeah.
The baby is looking for that, which is why we support and we promote, even for mothers who are starting their journey later than an hour or maybe a day or two, even if, for instance, if they're in the NICU or whatever, we support a lot of skin-to-skin attachment, and that you remove your clothes, you put the baby's skin against your skin, and that rekindles that instinct in the baby, and the baby roots. There are certain faces that the baby makes. It makes a yawning face, and then it moves around looking for the breast. So
So I have to tell you, by the way, on that skin to skin, this is slightly off the topic, but one of the deliveries that I'd attended, and it was in the birthing unit. This was in London, so it was in the birthing unit, very, alternative, candlelight, birthing ball and all of that.
Oh, nice.
And then the moment the baby is born, the mom was like, skin to skin, skin to skin, and the dad whipped off his shirt. And you're like, no, not you.
But see, that's the thing. In a lot of cases where mothers are in a bad shape, or if they've been through a traumatic birth or a difficult time, and they're maybe under or maybe not in the shape to actually help. A lot of times fathers do skin to skin, and that helps the baby as well, because it's the warmth of skin, because the child is coming from a warm environment out into a very cold and a very bright world, right? So it's also that keeps that instinct going until the mother's well enough, and maybe
so like moms are the best skin to skin, but in a pinch, dad can just Superman himself.
Totally do.
Yeah. But that is so crucial, and like you said, the golden hour. And over here we're very squeamish about the whole process, I think, and very squeamish about skin to skin also, because that implies that you just essentially are topless and you're just going to whack this lovely, warm, slimy baby onto you. But here it's very much, we want to clean it up. And
in fact, in Pakistan, it's, I think, only 18% of babies have skin to skin and feed within the first hour.
The WHO figures were 15%.
Oh, really?
As
so
opposed to the US, which has like 93 or 94%. Yeah.
That's
immense. The early initiation rates are just, they're
incredible.
off the charts.
Wow. So if you're able to do it, and okay, chalo, if not the first hour, then maybe the first few hours, or maybe a day even, but it's still early enough to establish that link with your baby.
Listen,
and just kind of begin the process.
Absolutely. But the thing is, what I'm trying to say here is not that if you miss that timeline, you will never be able to breastfeed.
Yes, also
that is
very
important to point out here, because there are women who have stopped breast, and I have personally helped people with that. So there are women who have stopped breastfeeding, and a month or two later, they now want to breastfeed. And you can also relactate. There are ways to relactate mothers who are not biological mothers either.
Adopted.
So adopted. So you can produce, your body is designed to do this. You just need the right education and the right people to speak to help you take ownership of your own body.
Yes.
Because you're the one doing the hard work. I'm not doing it. Another doctor won't be able to do this. Nobody will tell you that this is the amount of milk that your child needs. You need to follow your child's cues. You need to feed on demand. I think I can't say that enough.
Exactly.
Feeding on demand in the first few months of a baby's life is essential for the baby and for the mother.
And we're going to sort of expand on this, but after a very quick break. Stay with us. Hi, welcome back to the coffee table. We're talking about breastfeeding with Dr. Tanya, Soomro and Hareem Sumbul, who is a breastfeeding consultant, and we're having so much fun. I'm getting really into this conversation. It's really hitting home on a lot of things. So Hareem, tell me, in your work with moms who come to you about their lactation challenges, what's the most common thing that women seem to be facing? The most common challenge?
I don't make enough milk.
Okay.
And to that, my first question is, how do you know, sweetheart? How do you know that you don't make enough? See, so that perception is very skewed and very limited. What we feel is that if the baby continues to cry, and if the baby is crying, that means they're not fed well enough, right?
This is also what every woman around you will say, na?
Even I would
feed the baby, it's crying, feed the baby.
As a new mother, as a new mother, anyone would feel that way. Maybe it's something that I'm doing that is, or not doing, that is affecting the baby, and my baby is in distress. The child is not in distress. That's the way they communicate.
Right.
And this is what a neonatal ward nurse taught me when I was a 3-day-old mom. Because every time my child would cry, I would cry with her, tup, 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 tup. I would start crying. And she's like, you can't do this. You can't be doing this, because this is the way your child is communicating. It does not mean that she is in pain or she needs something. She is communicating that, oh, you're rubbing me down with cold water or whatever, or something is unpleasant or the light is too much, and she'll cry, So
And that's
first
so
thing is that.
important.
It's
And
very
I
important
think it
to
was
know.
just such a kindness to be told this,
Yes.
because it's so scary, those first few months or weeks. And if you're lucky enough to have a support system, then that's wonderful. But if
you're
you
not,
don't,
then you get bullied at a very raw time in your life.
Yes.
Yeah.
See, because it's not just the baby who's new to the world. The mother is at a very raw time in her life.
Yes.
She is emotionally, hormonally at a place where she's very fragile. You pass by a new mother and she can cry. It's that bad. So, and at that point in time, our society and the way we are built, we are forced to probably tell a mother that you're doing something wrong.
And everybody does it.
Everybody will do it.
Everybody does it.
Even
So
someone
you'll
who's
do it
come to
too.
sweep the room will have an opinion.
Yes.
Right?
And also air it.
Yeah. So, and the thing is, the one thing, coming back to your question, the one thing that I hear the most is, I'm not making enough. What do I do? Should I combination feed? Should I, move the child to some other alternative way of feeding or nutrition? And to that one thing, I say that it's very crucial for women to educate themselves before the baby comes, to know what are the signs of an underfed baby.
Oh, okay. So you
yeah.
ask the doctor now.
Yes,
Doctor.
please.
So, what are the signs? Because you meet many babies in your practice. So how do you know that your baby is doing all right?
I mean, I've got to say that another thing that I would add to what Hareem said is that actually I feel like in Pakistan it's very common to combination feed, So mothers will be breastfeeding and they will be giving a bottle because there is a misconception here that a baby needs to get used to the bottle, and so they will start the bottle early. And I feel like when mums come to me, and again, it's the same issue, right, that I'm not producing enough. And I feel like one of the main issues is that breastfeeding is a supply and demand, right? So it's not like an on-off tap that, no matter when you turn it on and off, you'll have a full supply of milk. It's that if you start supplementing with formula, then your own milk production will start to go down because your baby doesn't need that extra milk, right? So often when moms come to me and say, my milk is not enough, I'll ask them how much formula they're giving and how often they're giving it. And it generally takes about 3 days for a mom's milk supply to increase. So what I'll say to them is, look, over 3 days, if they're giving, let's say, 1 bottle a day, which is nothing, I'll say just stop it. If they're substantially bottle feeding, I'll say, look, over 3 days, breastfeed first, then top up. And over the 3 days, then gradually cut down the top-up feed, because then your own milk supply will increase.
And how do you know that you shouldn't be topping up at all?
So the thing is that I would say also, first of all, that yes, when a baby cries, don't always assume that they're hungry. It may be that the nappy needs to be changed, that they're sleepy, that they're windy, whatever, right? So having a little, that feeding when the baby wants is a good thing and is recommended. But in your mind, if you have a bit of an idea about their routine, how often are you feeding them? How often do they need to be fed? And generally, I would say, for me, it's a baby that isn't gaining weight.
Yeah.
That's the main thing, right?
That's the main
thing. So a baby that isn't gaining weight, a baby that's, whose urine output has gone down.
Diaper output and weight. These are the two
those are the
things.
things that you look at. Not like if I see a baby and the baby's nicely fed, well grown, gaining weight.
Hydrated.
Yeah, well hydrated. Even if the mom says, look, I'm worried that he's not feeding enough, I'll say, well, look at your baby. His weight is increasing gradually. He's looking healthy. He's peeing well. There's nothing to be worried about.
Also milestones, Tanya. I feel that milestones are very indicative of this, that if your baby is reaching the normal milestones, which are available, honestly, everywhere now with internet and everything.
And apps and all sorts of
everything,
things.
all sorts of things. If as long as your child is active and moving around and not lethargic all the time. There's a difference between sleeping, like for a new baby to be sleeping a lot, and then there's and then being lethargic.
But actually, with milestones, Hareem, what I would say is that the issues, the mom's concerns with feeding are usually in the first 6 weeks, and that after that, if a mom has managed to get over those first 6 weeks, then normally you're quite confident with your feeding.
But the first 6 weeks, you can really just look at the weight as well as the diaper output.
And this is a very easy kind of...
It's a very easy, simple formula. It's a very simple formula, and you can ask your pediatrician for it or whatever. You can go and Google it and really just find it. But
and is it also true that maybe, we also sort of seem to think that chubby babies are healthy babies?
Oh, that's
No,
so
that's
true.
so
I mean, in
untrue.
Pakistan, everybody thinks that.
Everybody
you
thinks
know?
that.
And that if I tell a mom that, look, your baby's on the 50th percentile, they'll look a bit disappointed. Really?
Why?
Yeah, the thing is, my child was on the 5th percentile, right? Which is rather low on the percentile. But we also have to understand what a percentile means.
Yes.
That means out of 100 kids, 5 kids will be this weight, and they'll be all right. I mean,
And it's still normal.
Yeah.
You're
It's
not
also
you've
very-
not dropped off
yeah.
a scale.
Well,
or
exactly.
anything.
So what's worrying is that, let's say, if your baby had started off on the 50th percentile,
Yeah, and then
dropped,
gone-
right? That would be very worrying.
So as long as they're sticking to their curve,
Exactly.
they're fine.
Yeah.
Okay. Yeah, these are things that, again, because it all ties into coming back to, breastfeeding and thinking that, is this enough? Is this okay? And then there's also a lot of self-esteem sort of wrapped up into this as well. Like, a lot of women feel like they should be doing this because they are mums and this is what mums do.
I think there are, again, coming back to what Dr. Tanya just said earlier on, that I think the choice needs to be with the mother. What really hurts me is that a lot of women also will make up things to not breastfeed.
Right.
Let me, use this platform to say this out loud, once and for all, that breastfeeding is no joke. It's difficult. It's hard work.
Yeah.
It's the natural thing. It's normal, but it doesn't come to you naturally.
That's a really important
That's
distinction.
very, very important.
Yeah.
It's a lot of hard work.
Yeah.
And it's your body that's involved. Nobody else decides for you that you need to breastfeed. You need to decide. We need to educate and empower women to know what they're doing and why they're. When you say fed is best, I would say fed is necessary.
Yeah.
Yes, I agree.
Fed is necessary.
I would say that it's the choice.
It's
that you
the
should,
choice. Fed is essential because otherwise there's no human being left.
Yeah,
of
You
course.
die if you're not
Fed.
if you're not fed. So fed is necessary. But out of the two options, you should have all the information available, which is better.
Yeah.
Right?
And better for you also. Because
Better for you as well,
Yeah.
because a mother going through mental health crisis and missing her
Yeah.
antidepressants
Yeah.
is not a good deal.
Yeah.
Yeah.
And
It's
I
not a
see
good
so many
deal.
moms actually who, when I'm taking a history and I ask moms, look, so what sort of milk is the baby on? And moms will look really upset and they'll say that, look, he's on formula, but I tried my best. And I feel like, look, that's your
That's
choice.
your
I'm
choice,
not,
it's perfect,
you
yeah.
know.
But I'm sure a lot of women do feel judged by their doctors,
Yeah.
by their moms,
And they
by
should,
people around them.
and that's
around.
wrong. But I feel
That's what
that,
needs to be stopped.
we should not, moms shouldn't feel worried about telling you,
Yeah.
that look, everybody is up, can make the choice, whatever suits them, whatever suits their mental health as well. I feel like, look, a happy mom is also far better for a baby and can look after a baby far better than a mom who's really stressed, who's really anxious, and who's not, happy with the breastfeeding, actually.
On that note, I also want to talk about a little about the fact how we don't know a lot of things that breast milk does for you.
Yeah.
Right? So
Which is part of being informed about breast
Yes,
milk.
it's very healthy for the mothers themselves. It deters cancer in the mothers, as well as it builds immunity for the child, and that's like that's a good gift that you want to give your child while they're growing
And
up.
also for the moms, actually, it leads to better postpartum weight loss.
Yeah.
Because you're burning a lot of
Because
calories.
you're burning off the calories, and it's a sort of very slow, natural way to lose that weight, right? And the other thing is that it delays your periods restarting, right?
Yeah.
So it's not something that you should use for birth control.
Also very important.
Yeah, that's also
because
very
you can
important.
totally get pregnant
Yes.
with it.
Yes,
Breastfeeding amenorrhea is not birth control.
Yes, yes, exactly. But
People
no,
really think it is, but
People really think
that's
it is.
how Irish twins
and it
happen.
reduces the risk of postpartum hemorrhage as well.
Yeah, yeah.
Because it
postpartum
helps your
hemorrhages.
uterus to contract.
Yeah.
Oh, okay.
So every time in the early days, every time you're breastfeeding, your uterus is contracting to its original size.
Yeah.
So that
Right.
also helps,
That's
So
really cool.
so it's basically like a mini labor that keeps going on the inside. Obviously, you don't feel that pain and all
No.
of that while
Usually.
you don't while you're breastfeeding.
Yeah.
But it's just that on the inside, it's doing exactly what it was while you were contracting afterwards.
I think I've read somewhere that breast milk also tailors itself to the baby's needs.
Yes.
So if your baby is ill, for example, then your
Colour
breast milk
changes.
will sort of,
Yeah, colour
and it will
changes.
sort of-
And actually for premature babies, that what's really, first of all, that if your baby is born premature, it's much harder for a mom to produce that breast milk, right?
Now, why is that?
Well, there are a couple of reasons. One is that actually your body in terms of maturity is not completely ready,
There,
right? The other thing is that if your baby is born premature, they're usually separate from you, right? They're in the baby unit.
Yeah.
You're not with them. You can't even see them.
That skin to skin is not happening.
Yes, exactly. And so, but the thing is that actually, if a mom does express milk, and you can, that you can take a picture of the baby, hold the picture in front of you, or sit by the baby's incubator, and the milk that you produce will actually be tailored to that premature baby. In terms of its protein content, its fat content.
Magic.
Yeah.
Like sometimes I'm just like, science, I love you.
Yeah.
This is fantastic, And on this note, we will take a very quick break, but come back to this fascinating conversation. Stay with us. Hi, welcome back. We're having a fascinating and so informative and fantastic conversation about breast milk and science. But so, Dr. Soomro, in the break, you were telling me about, I like saying in the break because it's like privy to, exactly that you don't know, but now you will know. So, is that we were talking about breast milk and we're talking about premature babies and how nursing a premature baby really helps it become stronger and you get antibodies. But you also told me something about infant mortality.
Basically, there was an article that came out in the Lancet that said that just breastfeeding alone is one of the most effective interventions we have to reduce infant mortality, and that in fact breastfeeding can reduce 13% of your under 5 deaths.
Wow, that's huge.
Yeah.
That's immense. And maybe one of the most obvious reasons is because it's sterile.
Well, actually, the thing is that so basically babies who are breastfed have a 6 times higher chance of surviving than babies who are bottle fed.
That's huge. That's immense.
Yeah, but even in America, that non-breastfed babies have a 25% higher mortality rate than babies who are breastfed. So that's even in developed countries.
That statistic right there is exactly why I started doing what I'm doing right now. Because when I heard of that statistic like a couple of years ago, and I was just blown away with that this is something so simple and basic, yet we do not have access to. The masses, let's say, don't have access to the education that goes around breastfeeding. So let's start talking about this. Let's start doing.
And you're also now reading to you are a student of the IBCLC.
Yeah,
IBCLC.
IBCLC. Yes, I'm an IBCLC student. So IBCLC is an international board certified lactation consultant.
Ooh, very cool.
So yeah.
Which is amazing, and good luck with that. But what I keep coming back to this is that on the one hand, we seem to kind of have this idea that nursing a baby is something that mums do when your baby's born and feed it, and that's fine. But and like you said, it's not as simple as we think it is.
Yeah.
So what are ways, what would you suggest? What would you recommend that mums do? Mums who want to breastfeed or want to relactate, or kind of get back on board? Because sometimes you have to stop nursing because you get sick, and then you have to take antibiotics. And I remember I had to stop nursing one of my kids because I got Hep A. Because waterborne disease, and I had to stop nursing. But luckily, my kid was about 1.5 by then, so I then just thought it's time to wean her. In any case, is but I just want to quickly ask one question here: is that when is a good time to start weaning your child
on solids?
Well, off breast milk.
It's up to every individual mom. So definitely the thing is that at 6 months you'll want to introduce solids.
Yes.
Right. So a child's milk supply will start going down a little bit. The need for milk will start going down a little bit from 6 months. And I feel it's up to every individual mom. So some moms who are really like, oh, Dr. Sumbul, when can I stop feeding? I'll say to them that, look, just get to 6 months, and then maybe when they get to 6 months, I'll be like, see if you can push it just a little bit more.
Because then, when they're eating, then they do drop a few feeds and automatically your life seems much easier.
It's much easier.
It's painless by then. You're having lesser issues. The way you're learning how to feed the child is also learning to feed more, effectively. Because then they would just have a 5-minute feed and then prance away. And that they're good. Otherwise, they would stay latched on for 40 minutes.
Is that a thing? Like if your child can be latched on for 40 minutes, but they're not actually
No, so
Nothing is really
the thing is,
happening.
there's a lot happening.
Okay.
So what the misconception that we have is that breastfeeding is only about nutrition. It's a lot about comfort as well. It's a lot about mental health of the child as well. This child was inside you for 9 months. Now they're out in a very well-lit place, in a very
Noisy,
stimulating space now, right? It's
I think that's
an
a better way.
overstimulating place. So you are still the center of their comfort. So a lot of times there's comfort as well. A lot of times, 9 out of 10 times, it is the baby signaling your body to produce more milk. Right?
So just
Definitely,
hold
yeah.
the baby.
It's the more the baby feeds, the more milk you
milk
produce.
will
Oh, so
produce.
just like a happy cycle.
Yeah, because the baby is growing very rapidly at that age, right? So as the baby grows, obviously their stomach size also increases. When they're born, it's like the size of a cherry, and in a month, it's the size of a chicken egg. So
Which is still quite small.
Still quite small.
But that's quite heartening because, coming back to the thing about is my milk enough?
Yeah.
It probably is enough.
It is, because the first few days, that's what I hear.
Tummy, then you just put it's full.
So the first few days, when a lot of women who reach out, they say that, but I only really have like a few droplets of colostrum in the first few days. And I was like, that's perfectly fine. That's all your child needs.
Very important.
It's very important because the first day for the first, if the child it's the first day of life. And then the second day of life, for each day up till 3 days, you have 1 diaper additional, So first day is 1 diaper, and the second day there's 2 diapers, and 3 days. That goes on to 6 days and all of that, and then it starts multiplying, Even then there's a formula, You can look it up.
And even
all
up to a month, it's just a chicken egg, which is really not that big.
It's not
so
that
one
big.
should just sort of keep on at it.
Yeah, so when the child feeds a lot, it's also called cluster feeding because there are certain different stages. Correct me if I'm wrong.
No, you're right.
So there's also cluster feeding that there are different developmental stages that come in a child's life, starting from the time that he's born, where they will cluster feed. You'll realize that in the evenings or certain times of the day, they will want to feed more and more, like they've just latched
in
off.
fact,
And
I
in 15
normally
minutes they
suggest
will-
it as a way of kids, for parents to get their kids into a routine, their babies into a routine, that if you're sort of, if you want your baby in a routine, you set the timings that you're planning to feed. And then normally what I would say is that before your bedtime, let's say if you want the baby to go to bed at 8, that then you give 3 feeds in quick succession, so maybe just like with an hour's gap between. That's cluster feeding, when you feed more often and, to fill the baby up a little bit more before bed.
Again, in the first month or so, in the first really early days, like first few weeks even, first week and things like that, they will feed a lot and you will feel overwhelmed. And that's perfectly normal. That's what your body needs and that's what the child needs as well.
So just kind of trust the system also.
Trust the system a little bit.
Go with the flow.
Yeah, and as long as your child is like, we discussed in great detail what are the signs of an underfed baby. As long as they're not anywhere on that, they should be fine. It's perfectly fine to be feeding your child more
And what
often.
about different ways to hold your baby while nursing them also? Because, we seem to think that this is the only way, and if it's not working, then everything is gone to pieces.
No, there are multiple ways, especially for mothers. I can speak from personal experience there as well, especially for mothers who have had a C-section. They can, feed the child in multiple ways. And even mothers who haven't, there's also a laid back position where the baby is on top of you, you're reclining a bit, and that, really gets the baby to strengthen their latch because they are sucking milk against gravity. Right? So there's that too. It's to teach them, some kids with shallower latches and weaker latches, they usually need that, or even for the mother's back, it's a lot of help with that. Then there are multiple. Then there's a football hold, and then there are different types of ways that you can feed a baby.
So if the usual
If one
position
doesn't
is
work,
not working for you, then you
multiple
should
other ways.
try different ways.
Absolutely.
And the main thing is to be comfortable while you're feeding.
Yes.
Get into a position where you're comfortable. Bring the baby to you as opposed to you leaning forward.
Don't hunch.
Yeah, keep the baby's head and body in a straight line and close to you.
Those are the things that you need to look
How
for.
do you know if the baby's latching properly? Like, how do you know if it's a shallow latch, for example?
So the areola, the dark part of your breast, is what needs to be inside the baby's mouth.
Right.
If the baby is clamping onto that, that will be painful, and that's what's called a shallow latch.
Okay,
right?
so if it's painful, then it's a probably pretty good way to judge it.
There's something wrong, and then a lot of times, either way. So if there's a lip tie or a tongue tie and all of those things happening, you need to take your child to a pediatrician. If your child is constantly not latching or having a problem, please consult your pediatrician. They are trained to figure out what is wrong. Yes,
They will know.
And an IBCLC. I mean,
Yes.
if someone outside of Pakistan is watching this, an IBCLC is also trained to figure out what a tongue tie or a lip tie looks like,
Excellent.
and they will be able to help you.
So you shouldn't sort of just suffer in silence thinking this is normal.
Yeah.
If it feels weird, it probably there's something
If
that
it's
needs to be
fixing.
discussed.
Yeah.
Now, I do know that there are some contraindications to breastfeeding as well. And what are those?
So the thing is that there are not very many contraindications, okay? One of them is certain medications that the mom might be taking, right? So certain types of anti-TB medicines, certain types of chemotherapy medicines, certain types of infections that the mom might have. But again, those are relative. So for example, you know, HIV and hepatitis B are relative reasons not to breastfeed your child. Because actually in a country where your baby's risk of dying from gastroenteritis is higher than their risk of contracting, you know, disease from you, then you can continue to breastfeed, you know? But otherwise, there are very few contraindications.
Okay. Well, that's also helpful. That in most, all things considered, you can carry on. And you can also take certain antibiotics and also keep
Yes.
nursing your
So
baby.
basically, when you were talking about antibiotics, one of the things is that, you know, antibiotics that are safe for a baby to take are generally safe for you to take while you're feeding.
Oh, okay.
Absolutely.
You know?
All right.
Yeah,
All right.
so
That's cool.
there's an entire array of medicines
Okay.
out there which your GP, your
And in fact,
doctors are
so for example, even like, you know, my drug book will tell me which medicines are contraindicated for a breastfeeding mom and which ones are allowed or which ones you can use with caution.
So it's always best to check.
Definitely.
But is it true that if you are, if for example, I have the flu and I nurse my baby, the baby will get flu antibodies?
Yes, that's true because see, that's the way it works. And we have another misconception that also comes to me through people who reach out is that, oh, I'm unwell, I'm under the weather. Should I stop feeding the baby because she might get it? And the fact is that because your body is producing antibodies to fight that illness, whatever you're ailing from, those antibodies are going to the child and making your child immune against the same thing. So yeah, that's
cool.
actually
I would
sort of
still,
helping.
I would still say though that to wash your hands frequently,
absolutely.
and to not sneeze and
sneeze
cough
on the baby.
It's not magic. You know?
So yeah, it's breast milk. That does not mean that you
magical.
that you
Let
vomit on
loose.
your baby and that will be all right. No, that's not
It's
fun.
fine. I'm nursing it. It's totally okay.
Yeah, so they will probably not get it from breast milk, but from other things, you still have to save them.
Yes,
That's a
yes.
very important point.
So, Hareem, do you have any sort of tips on how to manage your breastfeeding when you're sort of out and about, or if you have to go back to work? And some mums are sort of also a bit maybe squeamish about pumping.
Again, pumping is probably the one thing and the one way that you can manage stepping out. And the way to make it easy for you is that, you know, just use it as where we talk about topping up and all of those. Always consider topping up with your own breast milk first, right? So that's very important. We tend to jump to formula very quickly when anyone suggests topping up. So if you think and if you feel that your child is not getting enough, maybe start pumping after every nursing session. So once you're done with nursing your baby and your baby's content or gone to sleep or whatever, then you pump and you start building a stash while you're on maternity leave. Now that we have a 6-month maternity leave.
Yay!
So
and you know, in 3 days, you'll probably have enough to establish a pumping routine.
So so you'll have plenty. I know of people who had to travel away from the baby, and during that time, they would keep pumping just to keep their supply going. You know?
Also quite
and to prevent getting mastitis.
So there's the chance of getting mastitis, clogged ducts and all of that, and also your supply tanking. If you're away from the baby, your supply decreases because you're obviously the same supply demand cycle breaks.
So
and
you
your
can
body,
plan it, and you can plan it in ways that you can just keep your breastfeeding journey going and still have a life.
Absolutely.
Absolutely. This has been a fascinating conversation. Thank you so much, both of you.
Thank you.
For, you know, all your pearls of wisdom, or as I say, droplets of wisdom. Terrible puns. Thank you guys for watching this wonderful show. Please disseminate freely and widely to help all the mums in your life. If you're watching this on YouTube, don't forget to like and subscribe, and we will see you next time on The Coffee Table. Bye now.